So I just got home from a really interesting meeting in Sacramento, and the topic of the day was patient engagement. And it's a really hot topic in healthcare today for a lot of obvious reasons. And the core challenge that people are facing, it was interesting to hear people talk about it, because one of the things that struck me was the extent to which people had so many assumptions that were not supported by data or by real world evidence about patients and why they did or did not do things. And this is particularly true for low-income patients, where instead of data, people relied on stereotypes and narratives that are driven by either anecdotes or didn't have a place in reality in terms of how people behaved or how people saw things or how people interacted with the real world. And so as a result, we're seeing a lot of these preventive care services or other types of services that are being constructed and being built and being provided that are good, that are high quality, but they're not built with the customer or the patient's perspective in mind. And you know, the old saying in marketing rings true, which is, if you don't listen to your customers are going to stop listening to you. And it's definitely true in healthcare, and we're seeing that, where customers don't, or the patients don't really have much representation when these programs are first being designed or first being built. And that the only time we're really getting patient feedback is way down the line, after lots and lots of money has already been invested in these redesigns and these new systems and these new models, where there's a lot of sunk cost that's already been put in that hospitals are unwilling to back away from. Now, I know that there are a lot of patient-centered design theories or philosophies that are being pushed, and there's a lot of this energy and activity around getting the patient more involved in the design. But even then, the way that those kinds of things are structured are still very paternalistic, and they're still not a very solid way of incorporating patient feedback. Because what ends up happening is that you get a couple token patients that represent some of the demographics that are being targeted, and you get these people that are expected to speak for millions of other Americans, when in fact, the range of social determinants and barriers that people faced is as diverse as the United States is. And so what ends up happening is that you really don't get these perspectives well represented in the process of designing these services, delivering these services, or even getting the feedback around the effectiveness of these services. So in reality, the issue with patient engagement is fundamentally an issue with how health systems choose to gather information around patients and how patients think and the patient's psychology. If we look at industries like online retailers or consumer-facing brands that are very successful, you'll see that the way that they approach understanding their customer is extremely different. They go to where their customers are. They find out what the customers value, and not just value in terms of what they, the surface level manifestations of culture, but they look at the deep social structures. They look at belief systems, these very, very deep psychological beliefs about themselves, about their culture, and that's how they sell their products. And I hate to say it, but you look at tobacco, you look at some of these sin industries or these sin consumer products, and they are the best at it. They are on point, and they know 100% how do I get a person to buy this and to keep coming back and buying it more. And that's why they're so successful at selling their product again and again and again, even if there's plenty of evidence and plenty of PSAs around how smoking is bad for you, or around how soda gives you diabetes. People still buy that stuff. And they push huge volumes, and these companies are still making billions of dollars. So healthcare, we need to play a catch-up game. Let's look at the techniques that are used by retailers, by consumer-facing brands that are successful, and let's take those same concepts to create a positive direction. But right now, in the conversations I was having today, people were talking about buying media time with local TV stations and putting PSAs out on TV. And I'm thinking, who pays attention to PSAs? Right? Who's swayed or influenced by that? And the reason why they wanted to go down that route was that they just refused to believe that people who are low income have access to smartphones. They refused to believe that even though all of the data points to smartphone cannibalizing TV as the primary source for consuming media, and this is across all income groups, that even with all of that data, they still refuse to even consider social media or consider different form factors that are modern and that people are using today as their channel of communication. They insist on using something that was a joke in the 80s, public service announcements on broadcast TV stations. There are a lot of assumptions that we need to pick through within the healthcare field. We need to move away from this paternalistic attitude towards patients, of treating patients like they're simply stupid and ignorant, when in fact there are so many barriers that people face to doing the healthy thing. And we need to help them address those barriers if we're going to be effective at preventive care or addressing cost or helping people transition to a more healthy lifestyle. Anyway, that's my rant for the day. Some interesting observations from these health systems, and we'll see if health systems are more willing to incorporate some of these marketing strategies or tactics or techniques that are very successful in other industries and getting people to change their behavior.